global network of grassroots health activists and professionals, researchers, civil society organizations, academic institutions, and others who are concerned about the growing health inequalities. Inspired by the People's Health Charter, PHM Kenya is committed to the realization of comprehensive primary health care and addressing the social, environmental, and economic determinants of health. In September 2019, and 9 months after the government of Kenya began piloting the universal health coverage in 4 counties, the People's Health Movement Kenya commissioned a public perception study to better understand citizen expectations and experience of healthcare in general and universal health coverage in particular. This was meant to simply catalyze national discussions and overview of the citizens in terms of how do they think UHC should have been implemented. As at now, we have the implementation going on in 4 counties. It was for 1 year and it is supposed to be ending in December. At this point in time, we as the People's Health Movement then have had to take a step back and say, so as far as we are concerned, where are we? As beneficiaries of these health services that are delivered by government, where are we? So in today's meeting, we are going to give you what citizens outside there think about the implementation of the universal health coverage, both in pilot counties and in non-pilot counties. At this point in time, then I want to invite Angela from InfoTrak to take us through the findings of the study, and then we'll have a further discussion thereafter. Thank you very much.
Morning. Good morning. How is your Monday morning? Huh? Are you healthy? Do you have a UHC card? Who has a UHC card? Nobody. Who has an NHIF card? NHIF? Who knows something about UHC? Not many of us. Okay, so you're in the right place, because today we're going to be discussing this very important initiative by government to provide universal health coverage. And as Collins has said, we, in partnership with the People's Health Movement, basically wanted to understand and establish the perceptions, the views of Kenyans on this area of UHC, but also just health services in general, provision of health services in general. A little background about the study. The study was conducted between the 10th and 14th of September. It was a nationwide survey, so it was covering all the 8 regions. We went to half of the 47 counties. I will share that with you shortly. And then we did a bit of focus. We zeroed in on the 4 pilot counties because we needed to get a bit more information on how UHC is actually working in the pilot counties. So therefore, we had a sample of 1,200 and then a boosted sample of about 1056 interviews in Machakos, Nyeri, Isiolo, and Kisumu. And when you look at the data, therefore, the margin of error for this particular sample is plus or minus 3. I'm sure by now you understand how this works, that anything you see is plus or minus 3 with a degree of confidence or a confidence level of 95. So it means that 95 out of 100 times, if we ask that question that I'm going to share with you, the answer would remain the same. 5% of the time it may differ depending on the circumstances that prevail. Of course, the sampling was guided by the census data, population proportionate to size, and then the analysis of our information was done using SPSS version 25. That is the sample distribution, so it is proportionate to size in the sense that adults in Nairobi represent 12% of our population. The same goes for Coast at 8%, and so on and so forth. and then you get your 100% there. And then the way it has been apportioned to the sample is concomitant with those proportions that you see there of the adult population, which, you know, is generally, you know, as you see it in there. And I think there we have also given you the total number of households, which is about 11.7 million or 12 million households projected for 2019. And then the adult population, if I'm not wrong, is about 20 million. Yeah. That is a sample. Those are the counties that we covered. So as I said, there were, you know, about 24 counties. And you can see at the bottom there that there's a boosted sample. So whereas the Isiolo original sample by PPS is only 6, we boosted that sample to 300 so that we could get, you know, more robust information to make, you know, proper analysis with. And the same thing with Machakos, Nyeri, Kisumu. Those are the current four pilot counties for the UHC program right now. Right, so what are the, you know, key nuggets for you to take home? The first one is that, of course, as would be expected, affordable healthcare is still one of the key issues of concern for Kenyans. So you see that whilst there are other things that matter and Kenyans want to see addressed as a matter of concern, affordable healthcare is among the top 10 issues, both for the national government to deal with and also for county governments to deal with. Okay. And now if we then look in more detail at healthcare, because that's what's brought us here, we asked Kenyans on a scale of 1 to 5, how would you rate the government, both national and county, in the provision of healthcare services? And you can see that the rating of provision of healthcare services, both by national and county governments, is not great. So that Kenyans have rated 40% poor in terms of healthcare provision, and then 32% is average. So in total, if we looked at average and good poor performance in terms of healthcare provision, it's a whooping 74, isn't it? 72%, right? So only 28% of Kenyans feel that healthcare provision of services right now is good. And I think that's really something that government needs to pay key attention to and address as a matter of concern. Because it is one of those fundamental rights. It is amongst the 4 pillars in the Jubilee, you know, kind of mantra, and it needs to actually be, you know, looked at more critically. If you look at it in terms of service provision rating by region, then you see that pray for Western and Eastern, where service provision being rated as poor is under 40, you see that everywhere else it's significant. So at the coast, 44% rated healthcare service provision as poor. In Northeastern, 38%. Central, 42% rated healthcare as poor. Nairobi, 43%, Rift, 42%, and Nyanza at 42%. If we look on the flip side, for those who rated healthcare as good comparatively, then you see that we have Northeastern rating it at 37%, and that is really the highest percentage that we have there. We then also ask Kenyans, who do you feel is responsible for the provision of and payment of healthcare services in this country? And you see that when it comes to the provision of healthcare services, majority believe that it is the county government that's meant to provide healthcare services. But we also see 41% saying that national government is actually responsible for healthcare services. And then we have the MP being mentioned by 7%, so when they sometimes say they have to fork from their pocket, maybe this is what they're talking about. We see MCAs also being mentioned at 6%. So politicians in general are also perceived to be responsible, whether it is direct or perhaps even more critically through their legislative duties. Who then is responsible for payment of the healthcare services? Again, we see that county and national government rank highest. So we see 53% saying county government should pay for healthcare services, and national government is also, indicated there by 48% as being responsible for paying for healthcare services. But we also see that 15%, almost 15% of Kenyans believe that healthcare service payment is their own responsibility. And then we have CDF, we have the community, we have the employer, not very high ratings there, but certainly we see that it is government's responsibility, generally in the perception of most Kenyans, it is government's responsibility to pay for healthcare services. How much generally are, households spending in a year, a typical year? How much do you spend on healthcare? So a majority of Kenyans, that's 54%, spend up to 10,000. So if you look there, you will see that up to 10,000 is what most people are spending on healthcare in 1 year, right? And then you of course have 13% who don't know how much they spend. But these are people who generally had some sort of inkling on how much they spent on healthcare in a year. That can be contextualized better by the technical people as to whether this is an amount that is too high or too low or should not exist at all, because healthcare provision should be something that is, insulated by government or absorbed by government. And you can see when you get your handout where expenditure is highest and where it's lowest by region. In terms of distances that people travel to the nearest health facility, we see that majority travel up to 3 kilometers to the nearest health facility. And there are also people who are traveling even up to between 6 and 100 kilometers to reach the nearest health facility. And I think in terms of healthcare provision, if it is going to be fair to all Kenyans, then access is one of those things that should be critical, that you don't have to travel too long a distance to get quality healthcare service provision. And what kind of facility is this that is near you? Well, for majority of us, the facility that is near us is a public clinic or public dispensary. Then you have the public, and that's at 42%. Then you have your public health center, which is at 21%. And your much larger hospitals, level 4, 5, etc., sub-county and county public hospitals, those are only mentioned by 14% as their nearest health facility. So when we talk about the up to 3 kilometers travel distance, then you do see that it is congruent with those public health dispensaries and clinics. Okay, and then you can see it there by the regions. What is the nearest health facility to most of the Kenyans? We see that it is those two there. And the county public, the bigger hospitals that will be dealing with more complicated health issues and probably have better facilities, those are not that significant across the board. Do you have a medical insurance cover? Well, we have our work cut out for you if the data holds true, which it probably does. And that is that almost half, so majority, 51% of Kenyans say they do not have a medical insurance cover, whichever cover that is. So, and those who have a cover, the 49% who have a cover, have an NHIF cover. So 89% of those who said they have a cover have an NHIF cover. But critical importance here is that we do have half of Kenyans, majority, that's 51%, saying they do not currently have any form of medical insurance. And then when we look at the UHC card, then we see that only 8% penetration countrywide. In any case, the pilot has only been done in the 4 counties, and we will share with you as well what the penetration has been in those 4 counties. And then there is also the personal medical cover, so your different kind of covers, the ones probably you all have in this room. you constitute only 5%, if not less, of the population with a private health or medical cover. And then there is the employee-provided medical cover, and that was also mentioned by 5% of respondents. And county government medical covers that now have been introduced by some of the county governments was also mentioned by 1% of the respondents. And you can see the penetration of medical insurance covers by region. And so you see how, it is skewed in the areas where the UHC has actually been introduced. So we see Eastern, 62% saying yes, they now have a medical insurance. Central, where Nyeri is a pilot county, saying yes, 62%. But Nairobi, which is of course our hub, both administrative and business-wise, half of the people in Nairobi saying they have a medical insurance cover of some sort. And then of course Nyanza, where we also had the pilot county, Kisumu, we have 52% saying they have some sort of some sort of medical cover. But if you look at Coast, for instance, then you see that penetration of medical insurance is currently the lowest, alongside Western at 37% in Coast, and we see Western only 32% saying they have access to some sort of medical insurance. And you see where the penetration is across the board. We can see that NHIF is the main cover, and then we see that UHC is high in Eastern, in Central, and in Nyanza. Eastern 16% because we have two pilot counties there. We have Isiolo and Machakos as pilot counties in Eastern for the UHC. We have Nyeri in Central, and then we have Kisumu in Nyanza. Those are the 4 pilot counties that we have right now for UHC. So in the last 1 year, have you received healthcare services from any of the public health facilities in your county? And again, we see that actual use of public health facilities is not that significant. We have only 43% who have not visited a public health facility, with 57% saying they have not visited a health facility in the last 1 year. And you can see that those incidences are quite high across the board, very high and significant. Even in Eastern, where we had the pilot counties, more than half of the people there saying they have not visited a health facility. And you can also see Nyanza, another pilot region, with Kisumu as a pilot county, also saying 46% saying they have not visited a health facility. Why? Why have this 57% of Kenyans not visited a health facility in the last 1 year? Well, as you can imagine, the main prohibitor of not visiting a health facility is not because you're not sick, it's actually because you feel that there are poor medical facilities in the public sphere. So public health facilities are not of good quality. That's number one. And secondly, you don't have enough public health facilities in your area for you to actually go to. And of course, third is financial constraints. So actually paying for those services. And the location. So access is one of those things. And then the quality of the kind of public health facilities that we have. But by far and large, what you see here is that nearly half of Kenyans, at 40%, 47% say the reason why they have not visited a public health facility in the last 1 year is because of poor medical services. They don't get the quality that they're expecting and the quality they feel they deserve. And then the inadequacy, there's not enough. In some of the places when we looked at the qualitative data, it takes so long to actually get services because you're queuing to see the medical practitioner in those facilities. And then of course the distances that you will have to travel sometimes, especially to get specialized health care. And then of course there's a cost there, yeah? But we also see other things being mentioned. We see people talking about self-medication. So they decide to self-medicate, as mentioned by 7%. 2% said they use traditional medicine. And then there's a 1%, which I think everybody in this room belongs to, who says, I use online medical solutions. So you have a headache, and you go to Google, and you get Google Doctor to treat you, which is in many cases not a good thing to do. How satisfied are you with, for those who have visited the public health facilities, how satisfied are you with healthcare provision in those public health facilities? And what you see is that satisfaction overall for those who have visited health facilities is 43%. 38% are totally dissatisfied, and 19% find the services as average. They're just, 50-50, yeah? And you can see how, satisfaction levels are across the board. So that in Northeastern you have 44% who are dissatisfied, in Western 44% dissatisfied, in Nairobi we have 45% of Kenyans dissatisfied, and in Rift Valley 42% of Kenyans dissatisfied. I think this calls for both our county and national government health, technocrats to critically assess what needs to be done to ensure that satisfaction levels in terms of the quality that is provided in those healthcare institutions is improved, so that we're getting comparatively good healthcare service provision as Kenyans, as we so rightly deserve. Now let me focus on UHC, which is universal health coverage. I had asked earlier whether anybody knew what UHC is. So let me start off by giving you a definition that was used when we realized that awareness was low amongst Kenyans. So universal health coverage, UHC, is a government program meant to ensure all persons receive quality healthcare services they need without spending a lot of money. So it doesn't necessarily mean it's going to be free, but you don't have to spend significant amounts of money. The key features of UHC are that one, of course, you have to be a Kenyan citizen. Secondly, one needs to register and obtain a UHC card, which will be issued by the National Hospital Insurance Fund in various health facilities. Registration for the card is free. One will be required to produce his or her UHC card to access UHC services. So that's all you need to do. Go, and then you register, and you get your UHC card. But of course, in the pilot phase, the UHC services have been completely free. In the phases ensuing, Collins, if I'm not wrong, UHC will actually cost something. That something is not yet clear, but it will not be a free service. Okay, are we together? So, what's the first thing? Are you aware? So we ask citizens, are you aware of the universal health coverage? And of course, you can see that almost 70% of Kenyans, majority, do not know about UHC. Only 31% are aware of UHC, and those who are aware through television advertising, radio advertising, and then word of mouth through friends and family, and also from a health practitioner, as we see with 10% there. But by far and large, the broadcast media, that is TV and radio, control about 55% of source of awareness, and then 18% is through referrals. How does awareness pan out by region? We see that awareness is high, but not significantly high in the regions where we have the pilot counties. So in Nyanza, where Kisumu is a pilot county, we have 45% awareness. One would think it would be higher. In Central, we have 40% overall awareness of UHC. And then in Eastern, we have 36%, only 36% awareness of UHC. But if you look at all the other regions where UHC will also be introduced in, not too far the future, so soon, we see that awareness in Nairobi, which should naturally be high, is only at 33%. Western, awareness is 27% of UHC. Rift Valley, awareness is at 26%. And at the coast, it's at 20, and in Northeastern, it's at 13%. That is how it pans out to the 31% awareness. So again, I think the Ministry of Health and county governments have their work cut out for them, because you cannot use something that you don't know. The first stage to usage is actually education and awareness. So if awareness right now is at 31%, with whatever targets government has to ensure that we all get a UHC cover, I think they need to actually increase the impetus in terms of awareness of UHC. Awareness is obviously, as we see, the highest amongst the educated. So we see that university and post-university educated people have an awareness level of about 44%. But even amongst those, we have significantly higher awareness. But look at what the awareness levels are for primary and secondary educated people. It's very low, it's about 24%. So the question then will be, how do you simplify the messaging so that everybody can understand the UHC concept without having to struggle too much? If we have even educated people who have been exposed to UHC not being aware, then there must be something that is causing those knowledge gaps that needs to be sorted out before the nationwide rollout. Very interesting that there are misconceptions about what UHC is. And that again is something that our technocrats and our policymakers and government at large will have to deal with, including the CBOs that deal with healthcare, like Haki Jamii. The first one is that 59% believe that with the UHC, one can access free healthcare services in any health facility in the country. So 59% of Kenyans are not right. They're wrong in the sense that, in reality, with the UHC card, you can only access what? You can only access a public health facility. So you can't go to a private health facility like you can normally with your NHIF, for instance, and access services. It will only be confined to public health facilities. So that is something that needs to be sorted out, that UHC gives you access to healthcare facilities in the country. Any is not any, it's any public health facility. Okay? The second misconception, that is by 66% of Kenyans, is that with UHC, I can access free healthcare services in any healthcare institution in the country. That too is not correct. Why is that not correct as a perception? Because you cannot access free healthcare moving forward. UHC itself, and I think the technical people in the room will explain, there's a bit of confusion. At this pilot phase, during this pilot phase in the 4 counties, the public has actually gotten the UHC card for free. But in the phases moving forward, when you and I go and get our UHC card, we will actually be getting it for a specific amount of money. That amount of money is not yet being communicated with clarity, but it will not be a free card, okay? And that may pose a problem when, after the pilot, you now start asking people to pay, isn't it? When during the pilot phase, they were getting it for free. Although on the flip side, one wants to get as many advocates and users as possible, so you kind of try and lure them with something that is got low barriers to entry. The third misconception is that with UHC, one has to be a member of NHIF to access healthcare services, and that's mentioned again by 52% of Kenyans. Now, whilst you have to go and get your UHC card in an NHIF facility, you don't necessarily have to have an NHIF card. This is our understanding of UHC. The two are mutually exclusive. So one is not a precursor for the other, that you must have. What you must have is identification to show that you are a Kenyan. After you've confirmed and proven that you're a Kenyan, you only need to go to that healthcare facility to get this. But majority of people right now believe that you do have to have an NHIF card to access services. So you see how the barriers will then become very serious there. Because remember, in the first place here, so that I want you to see the link. 51% don't have what? They don't have medical insurance. Yeah? So only 49% have medical insurance, and of those 49%,